trial denture, establish all those records. Now we're finally ready to fabricate our dentures. So with CAM, or computer aided manufacturing, there are two categories. One of those is going to be milling, which is subtractive, and the other is going to be printing, which is additive. And so typically you'll hear milling referred to as subtractive manufacturing and printing referred to as additive manufacturing. So whenever you hear somebody use those, they're often interchangeable. So subtractive manufacturing is milling, additive manufacturing is printing. And we call it subtractive manufacturing because you're starting with some sort of material. For dentures, it's going to be polymethyl methacrylate. For a crown, it might be Emax or zirconia. You're starting with a block or a puck of that, and then you're subtracting away the extra material to get your final prosthesis. So I always like to say that milled dentures are like when Michelangelo chiseled David out of marble, and each denture is a little work of art. The one thing that I think is important to note here, that milled dentures or dentures fabricated with subtractive manufacturing techniques are made of PMMA, which is also called polymethyl methacrylate. And if you remember one of my very first slides where I showed conventionally processed dentures, we were utilizing PMMA or polymethyl methacrylate in 1937 to make our conventional dentures. And what that means is the milled dentures that we make today in 2025 are actually the same exact chemical compound that we've been using for nearly 100 years. So again, everything is new and the way that we make it is new. The workflows are new, but the materials are not necessarily brand new. So this is a material that's time tested. We've been using it literally for a century. But now we found a way to make it better. And we make it better by pre-polymerizing it. And what that means is when we make a denture, normally with the press pack that I showed you, we're investing, we're moving things around, we're packing it, we're going in many layers, and every one of those steps introduces a little bit of error. The most significant of those is what we call polymerization error. So while your denture is being made, the material is actually contracting away from the master cast. So there's always error introduced when you process a denture conventionally. When you mill a denture, that error is already gone. So the mill is using this pre-polymerized resin to create a true one-to-one fit against the tissue. So the best fit we can get with a PMMA denture is going to be subtractive manufacturing. And this photo, sorry, let me go back one more. You're seeing a monolithic milled denture. So there's a lot of different brands that make these pucks now, including Ivoclar, Avident, Baltic. There's many, many brands where you can have the denture teeth and the denture base milled from the same puck of resin. So that means with this type of denture, there are no separate denture teeth. The denture teeth and the denture base are polymerized at the same time. And that's really exciting to me. If you would prefer the look and strength and feel of a carded denture tooth, you can actually just mill the denture base and then bond in the carded denture teeth. So you can really customize these workflows and materials to meet your expectations. So I have a lot of colleagues that are very used to the look and feel of a carded denture tooth, but they want to capitalize on the benefits of the efficient workflow and the repeatability and the strength of the milled denture base. So if that sounds like you might be interested in this type of workflow that involves the milled CAD/CAM denture base with a carded denture teeth bonded into it. This is another view of that monolithic milled denture. So you can see when the puck is made, the denture tooth resin and the denture base resin are polymerized together. And then the software knows where those two lines meet, so you can get a really nice, very strong prosthesis. And again, we're avoiding that polymerization error. It's already happened when the puck was made. So now when we get that final denture fabricated, we have that nice fit. There has been many, many, many studies. So I showed you that slide from 2012. We've been working with milled polymethyl methacrylate dentures since 2012, meaning we have over 10 years of data, lots of systematic reviews, lots of reviews of the literature where we can start to see the benefits of that. So the current evidence base today shows that CAD/CAM milled dentures have a superior fit, mechanical properties, and physical properties to conventionally processed polymethyl methacrylate. So aside from subtractive manufacturing, the more exciting thing today is usually talking about additive manufacturing. This is more scalable for laboratories. So a lot of laboratories are moving forward and pushing forward the advancing 3D printing, and it's more affordable for clinicians. So it's a lot easier to get a printer in-house and fabricate prosthetics that way versus getting a nice 5-axis mill in-house and fabricating dentures that way. And so you can see here, I'll restart this video. We have a vat of resin. So this is a liquid uncured resin. And then there's a light that's a certain wavelength inside of the printer that's curing that. And so you can see this is curing layer by layer and fabricating this denture base. So you're taking this material, adding the layers one at a time and building it up that way. So it's additive manufacturing. I like to tell my dental students that this is very similar to the very first composite they do in first year dental school, where you do a teeny layer of composite and cure it, then you do a teeny layer of composite and cure it, then you do a teeny layer of composite and cure it to build the beautiful class 1 composite resin. The printer is doing that at a much finer level to fabricate whatever you're 3D printing. And this is showing you fabricate one thing at a time. So most vat printers allow you to print one shade of resin or one type of resin at a time. And so here you can print several denture bases on one plate, or you can print several arches of denture teeth on one plate. And then you take those two pieces and you bond them together. So with conventional vat printing, the teeth and the base are printed separately and then they're fused together, following manufacturer's protocols. So VJ was saying we've worked together for many, many, many years. The first commercially available printed dentures came out in 2017. So after it was FDA cleared, then they finalized the marketing. And so by the time we started seeding these, it was in 2017. And I would like to show you 4 of my cases that failed in 2017. And you can see I thought this was really exciting because we have a mixed failure here where we had kind of a debond and a fracture. We have a cohesive failure here in the middle where we have a fracture within the denture teeth. We have this fantastic debonding of a segment here, which I thought was really fascinating because in my mind, we're fusing this whole unit of teeth together so we don't have to worry about single teeth debonding because there are no single teeth. And then my patient showed me I was wrong because you can debond an entire segment of teeth. So this would be an adhesive failure. But one I think is really interesting is this one on the far right. This was an immediate denture that I delivered. And I had the patient come back for their 24-hour post-op consult. And this was what their denture looked like. And I was just astonished at the amount of stain that could accumulate in 24 hours for this patient's denture. And I like to show this partly as a historical context because none of these resins you will get today if you order a digital denture from a dental lab. But this is kind of the evolution. So these were the first generation of resins. We often refer to them as that now, which is first generation printed resins. The physical properties were not ideal. We saw a lot of failures. And so a lot of early adopters and people that were excited about 3D printing tried this out for you. So you're welcome. So that now we can have finally materials that are strong and beautiful and more like what we expect to provide for our patients. I will do an asterisk that every single one of those dentures I remade at no charge for my patients. So these are a set of dentures delivered back in 2022. So this was with a high impact printed resins. And what I think is really cool about this picture is if you look at the characterization in the denture with the stippling on the denture base and kind of the mamelons and that anatomy on the denture teeth, all of that was designed in the software. And so when it was 3D printed, it translated the stippling and the gingival effects, as well as the mamelons and the enamel effects, all came through during that 3D print. So we've really come a long way with not only the resins, but also the printing technology, as well as the design software. And certainly with the aesthetics. of the denture teeth and the denture base. All right. Now in 2024, we started to see commercial release. This was released in 2024 at Lab Day, where we can start to see monolithic printed dentures. And so these are not that printer. So this is a different type of printer called filament printing or FDM or jetting printing. And so you can see here the denture base and the denture teeth were all 3D printed monolithically. And in this bottom photo where you can see all these dentures that are nested on the plate, what's really cool is that each one of these can be a different shade. So, and you can even print different shades of teeth on the same denture. So if you wanted to have like more bright teeth in the front or darker teeth in the back, or have characterization at the cervical and come down brighter at the incisal, you can do that with these printers. They function more like inkjet printers, where you can have like the cyan and the magenta and the blue, and they can all kind of blend together at that certain amount to get the shade you want. That's essentially what the filament's doing on these printers as they work. The downside is, since they are more novel, they're kind of at that early stage in their development. So even though they're starting to look very nice, they're working now on improving the strength and getting the high impact that you see with some of the current printed and milled resins today. And kind of piggybacking off of that statement, even within the VAT printers, not all printers and not all resins are created equal. And this was a study that we had done with our residents that we published in Journal of Prosthetic Dentistry. And you can see we have injection molding. So this is a conventional type of processing here, CNC milling, compression molding. So the one we were doing in 1937. And then these three are all different types of printers. And what we're looking at is the surface roughness. So how smooth is that resin when it comes off of the printer? And this one over here, totally different from the other two. And so because the formulation is different from printer to printer, we're not quite sure yet if it's the printer that's the issue, or the resin that's the issue, or the software that's the issue. So these are kind of the things that we're working through right now. As kind of a follow-up to that study, we looked under the scanning electron microscope at those resins. And you can see on the left, this printed resin looks really, really smooth. I'd be really confident with that material in my patient's mouth. But the one on the right is also a printed resin. And so you can start to see the variability from resin to resin with printing that we don't necessarily see with conventional processing or milling. With those technologies, we know what it's going to look like, whether it's very rough or not. It's consistent across the process. So to kind of wrap up 3D printing, these are two really lovely, comprehensive narrative reviews of the literature that both came out in the 2020s. And they both came to the same conclusion, both by two different prosthodontic groups at two different universities, saying that printing looks like it's the future. It's incredibly promising, but we don't yet have the evidence base to say that 3D printing is the same as milling or conventional techniques. So to summarize, we can certainly mix and match whatever we want. So you can have a printed denture base with milled denture teeth. You can have a milled denture base with carded denture teeth, or any combination of the above. So you can really mix and match the materials for whatever you believe in and whatever works within your practice to capitalize on those workflows for your patients.